Good afternoon. Welcome to the Quality Industry Spotlight powered by PQA. I'm Richard Schmitz, PQA's Chief Engagement Officer. Today's webinar, Elevate Your Game, Payer-Pharmacy Partnerships to Improve Quality Performance, will offer insights into Outcomes work and its expansive pharmacy network designed to support and enhance health plans' efforts to maintain and improve performance on HEDIS and Star measures. Before today's presentation, let's cover a few logistics items. First, send us your questions throughout the webinar using the Q&A feature at the bottom of the screen. You can send questions to our speakers at any time. Second, today's forum is being recorded, and a copy of the slides will be shared with our members within a week and posted in the website's Member Resources Library. And finally, at the conclusion of today's webinar, a brief survey will launch. We always appreciate your feedback on PQA's programs and activities. Today's presentation is sponsored by Outcomes. As a reminder, PQA does not endorse, recommend, or favor any product, organization, or services. I'd now like to introduce today's speakers. First, Kevin Boesen, Senior Vice President for Payer Markets at Outcomes. Julia Johnson, Account Executive for Payer Sales at Outcomes, and Lisanne Holley, Program Manager for Government Quality Programs at Highmark Health. I'll now turn things over to Kevin to get us started. Kevin.
Thank you, Richard. I'm really excited to have the opportunity to speak to everybody today. As Richard said, my name's Kevin Boesen. I'm a pharmacist. I've had the opportunity to work in a number of different pharmacy settings, including hospital, retail, industry, academia, technology, and services. I love everything about being a pharmacist. Like many pharmacists, I also come from a pharmacy family. My wife's a pharmacist. I have two brothers that are pharmacists. My dad's a pharmacist. And we've all done a number of different duties and responsibilities in our career. And I'm excited to see where pharmacy's been and where it's going. At Outcomes, we believe that the pharmacist is really the core pillar as part of the healthcare ecosystem, particularly as chronic disease continues to expand and patients take more and more medications. If you look at patients who take at least one medication, a recent study concluded that those people visit the pharmacy 35 times per year. That's more than 10 times than they see their PCP. So there's tremendous amount of access. Most Americans live very close to a community pharmacy, and that's no different even with some of the challenges in pharmacy closures. And the pharmacist is really an expert in terms of chronic disease and medications used to treat chronic illness. And with the growing physician shortage, there has to be a change in terms of the pharmacist role. So if you look back at where we were not too long ago, that the core community pharmacist would fill prescription medications and evaluate drug utilization. So do prescriptions interact with each other? And I think that was okay when we took 2 to 3 different medications. But recent studies have shown that not only seniors, but just adults, 7 out of 10 adults, 40 years and older, take at least one prescription medication, and almost 1 in 5 adults 40 and over take 5 or more prescription medications. And that's really evolved the need for medication management. Pharmacists looking holistically at medication profiles to see what we can do to optimize treatment and outcomes. Where it's going in the future, care management. So looking at not only medication utilization and appropriate use of medications for conditions, but what else needs to be there to support patients who have chronic conditions, whether it's nutrition, exercise, other lifestyle changes, and pharmacists getting more and more involved in those services. And then ultimately, we see the community pharmacist as a primary care provider. And you see that in a number of markets where pharmacists can prescribe under test and treat models, under collaborative practice models. And it's really exciting to see where the pharmacist is going. So with that, Outcomes as an organization, some of you know us well, some of you may not know us as well. We've really grown over the last couple of years through a combination of a number of different companies. And so many of you on the payer side are familiar with our Outcomes legacy solutions that connect payers with community pharmacies to provide clinical services. But a big portion of our company is really integrated within the community pharmacy in a technology space. So we support a number of pharmacy management systems for independent pharmacies. We support patient engagement solutions for a number of community pharmacies. And we also offer single sign-on or some sort of collaborative integration with one of our solutions with about 40,000 pharmacies. So that allows us to be very well embedded within pharmacy workflow to deliver clinical services. My role at Outcomes is to work with payers specifically. So I help payers connect programs, solutions, needs, things that they have with the community pharmacy to deliver those services. Our vision then, and this is how it looks, is that the pharmacist, like I said, is really at the center of this healthcare ecosystem between clinicians, um, specialists, primary care providers, PBMs, payers. We have a tremendous amount of access to data. And so we really want to empower the pharmacist to be that ultimate provider that we envision that they will be in the future. So for pharmacies, we really focus on optimizing their workflow, helping them really take their clinical solutions along with all their other day-to-day activities and put those within workflows so that they can be productive and efficient. And then from a payer standpoint, the ability for payers to leverage this natural resource to optimize patient engagement. We offer MTM type services in Medicare, Medicaid, and commercial spaces. In many cases, we're doing comprehensive medication reviews, but we also do a lot of targeted interventions meant to address Star, HEDIS, drug costs, specialty medications. And then we also support pharmacists in their role as providers. So we have medical billing solutions for pharmacies. We offer test and treat support under that as well. So different clinical workflows to enable pharmacies who are practicing in that environment. And then we also support thousands of pharmacies' collaborative practice agreements that are used for things like vaccinations, test and treat modules, or other chronic disease programs. Our vision of how the community pharmacist practices is really changing from being responsive to prescriptions that are coming in and really being have a work practice that's built around dispensing medications, but really flip that and have a program that's really built around their clinical activities. So the way that Outcomes has built our clinical solution is that the first thing the pharmacist will do is log into their clinical platform. That clinical platform then drives the work activity, the solutions, the patient engagement throughout the day. So they log into a clinical platform. They'll utilize our patient engagement solutions, and that can be as simple as an IVR two-way text with patients to engage them. It can also be very proactive monitoring for patients for things like medication adherence, other gaps in care, to reach out to those patients, have them come into a pharmacy. It can involve coordination of face-to-face meetings with patients to do comprehensive medication reviews or medication synchronization. And then we move into the pharmacy's dispensing platform to optimize that workflow for filling the prescriptions. All of that then is supported with embedded data and analytics. So really it's an opportunity. What we've done as a company is to take the pharmacy's workflow solution and completely change it. So it's much more clinically focused and less dispensing focused. Our pharmacy network today has over 65,000 contracted pharmacies, or what we call MTM centers. More than 96% of all retail pharmacies are contracted under the Outcomes platform. So we have broad reach to a number of different patients through whatever pharmacies they happen to be using. Those are your chains, independents. We have a large network team that works with all the pharmacies to help support their activities. So ensuring that they're providing the work that the payers are asking them to do, but also delivering on that care and maybe proactively offering payers different solutions. You'll see in the pie chart next to the number 1 that we've got a growing number of other types of MTM centers. And our other speaker, Lisanne with Highmark, will talk a little bit about the evolution of pharmacists. And as we develop relationships with pharmacies or pharmacists that are working in clinics or in other provider offices. If you look at our activity of the pharmacy network, it grows year over year. Last year, our pharmacy network completed over 11 million claims. Almost 1 million of those were comprehensive medication reviews, and 10 million of those were our target interventions. So interventions designed to achieve a specific outcome. We offer very comprehensive pharmacist-led intervention workflows. So we help guide the pharmacist through a lot of their clinical consultations. And in total, this network really is invested in the community pharmacy. And in 2024, we provided payments back to community pharmacies in excess of $170 million. We're very excited to work with PQA and expand opportunities, develop relationships with all PQA members. So in November of the PQA leadership session, we conducted a recent session or focus group, and we divided the group into pharmacies that were in attendance as well as payers that were in attendance. And we asked both of them sort of similar questions. We wanted the pharmacies to talk about the types of clinical solutions that they wanted to provide for payers in advancing their practice. And then we talked to payers about what payers were looking to see from pharmacies that would align with some of their clinical needs. The areas that popped out, the payer side is there on the left. Focus areas included asthma measures, so asthma medication ratio, pediatric health outcomes, screenings for A1C blood pressure readings, nicotine cessation initiatives, as well as support for some of the newer STAR measures. On the pharmacy side, pharmacists were very interested in providing more clinical biometric type of services, including A1C testing and blood pressure monitoring. Wanted to work and partner with the payers in formulary compliance, so helping patients do year-over-year adjustments if formularies were going to change, or if there were lower cost alternatives to support things like medication adherence. They were very interested in nicotine cessation programs, health screenings, and then some pharmacies were interested in providing more injectable medication administration to support behavioral health needs. If you look at the areas of overlap between the payer and the pharmacy, some key areas of focus included A1C, blood pressure, nicotine cessation, and formulary management. So as we've moved for programs this year, we've really focused on finding the sweet spot in the middle of this Venn diagram and providing some of those additional solutions. Now I just want to touch a little bit on our featured products and capabilities, and then I'm going to turn it over to Julia and Lisanne for a discussion. As you're sort of listening to them, or there's any part of this presentation that you want to ask questions about, there is a Q&A dialogue box that's open. Feel free to ask those questions, and we'll work those into the conversation that Julia has with Lisanne at the end. So from Outcomes, our typical solutions really support MTM products. Many of you are familiar in managing Medicare required MTM solutions. Those include comprehensive med reviews, targeted med reviews, but we also offer a number of different solutions that support Medicare and then the other markets, Medicaid, commercial markets, through our programs. We have multi-channel access. We provide full data validation support. We offer a tremendous amount of analytics, processing, and management. Our product is HITRUST certified, and we have numbers of different quality assurance programs to support the activities that we're doing. Our clinical engine is something that we probably don't talk as much about. We talk a lot about the network and our ability to engage the network in meaningful clinical interventions, but we also have the ability to do a tremendous amount of collaboration of payers in mining data to look at proactively about identifying risk stratifying patients and looking at opportunities to provide services that'll produce the most high value and return on investment to payers. Much of our program really focuses on closing quality gaps. So the feature that we'll talk about, Julie and Lisanne will talk into, is medication adherence. But as I mentioned, there's a number of different quality gaps that we look to try to close. Specifically, health testing, so blood pressure and A1Cs. We run programs throughout the country that look at very different models of this. Some of these are supported by administrative budgets by different payers and health plans. Some of these are supported through the medical benefit, where pharmacists are able to medically bill for providing blood pressure or A1C readings. In many cases, a lot of pharmacies are using point-of-care testing within the pharmacy to do the A1C readings as well. Medication adherence includes things like new therapy consults, refill reminders, and some longitudinal programs that we'll get into much more detail. Disease state education is a big one. So pharmacies will work with patients longitudinally. And this is where we're seeing a lot more in the care management space, where pharmacies are talking to patients who have chronic illness, not only about the medications that they use to treat them, but also lifestyle changes, diet, exercise. Many of the pharmacies that we partner with are within grocery stores, and we've seen a lot on the grocery side of the integration of the pharmacy that's in that store and doing a lot more consultation with patients around their nutrition and shopping needs. I had the opportunity recently to go visit one of our grocery retailers and really spend a lot of time understanding where they're going with supporting patients with their nutritional needs. And I think that's a great opportunity. And then vaccinations are always going to be a key area for pharmacy. I think more patients are using the pharmacy not only for their annual flu shots. Pharmacies are getting creative in terms of going out in the community and delivering those, but then also other vaccination programs as well. I think where pharmacy really stepped up during the COVID pandemic of providing vaccines, if not for community pharmacy and their role, I think the pandemic could have been much worse and lasted much longer. And then therapy optimization. So the ability for pharmacies to add or change medications in the vision that I have for the pharmacist for the future is we really believe that the pharmacy will not only, reach out to physicians to change medications, but I think in many cases, the pharmacist will work under collaborative practice to actually prescribe those medications, or in some states, be able to prescribe those medications as well. So where historically pharmacy programs have had difficulty doing things like statin gap closure, there really shouldn't be a reason why a trained pharmacist couldn't work with a patient and their provider to prescribe those medications. Or if a patient is managing diabetes, that a pharmacist is really working with a patient to prescribe and make changes to their diabetes medications. Medication administration. I mentioned during the PQA session that we had that many community pharmacies wanted to get involved with even injectable medication administration. So long-acting psychotropic medications would be something where community pharmacies are interested in participating a little bit more. And then looking at cost-effective treatment alternatives as well. So with that, I'm going to turn it over to Julia to jump in and talk a little bit about our adherence programs and then get the perspective from one of our great health plan partners.
Yeah, thanks, Kevin. So at Outcomes, we offer a suite of adherence services that range from supply management to longitudinal engagement services throughout the year. And that also includes a multi-channel approach. You'll see here, we package these programs in a few different ways, all centered around those suite of services. So first off, our supplemental adherence program, this is where the health plan can really pick and choose what services to deploy. This is usually leveraged when outcomes is just a piece of the overall strategy for the health plan. Then we have two risk-based programs, one we call our member adherence program. This is a risk-based model where the health plan only pays if the member ends the year adherent. This is ideal for health plans wanting a performance-based program targeting specific members. And then lastly, our population adherence program. This is another performance-based arrangement. This is typically set up in a star rating guarantee or adherent rate guarantee at the CMS contract level. This is the program we've been running that was originally started with Health now Highmark. They took a chance on us about 5 years ago, and they were the first one that started running this program with us. We've developed a great partnership over the years, and we really truly value the relationship we've developed. But with that, I really am excited to bring on Lisanne from Highmark to do a little Q&A about herself and get a little glimpse inside of some of her adherence program strategies. So with that, I'm going to kind of slide in over here to some Q&A, and we're going to start off by getting to know Lisanne a little bit more. And so Lisanne, yeah, I just wanted to start off with a question for us to be able to, like, personal with you. What led you to your role as a pharmacist working to drive quality performance within a health plan?
Yeah, hi, Julia. Happy to be here today, talk about this. Unlike Kevin, who comes from a long line of pharmacists within his family, which is very impressive, for me, it was really just my interest in science and math, I'll say. So, healthcare felt like a natural path for me in terms of a career. So, but when I started pharmacy school, I really just figured I'd practice in a retail or hospital setting. I mean, those were the care settings that were most visible to me. And for most, I think. But school really opened up my eyes to a range of opportunities for pharmacists. I think during my residency, it was really a turning point where I worked in ambulatory care and managed care pharmacy, and that's what led me to a career really at a health plan after I finished that residency program. And it's really been a perfect home for me. I love working on quality initiatives, managing, driving strategy for our pharmacy programs. So it's been a great environment, and it's really expanded my skill set and helped me grow professionally.
Yeah, I mean, I have similar sentiments from when I started as a pharmacy technician in retail pharmacy. At that time, I never even realized there was a place for pharmacy outside of retail or hospital. So here we are. So another question, what are the primary advantages of a pharmacy-driven adherence program from your perspective in your position, Lisanne?
Yeah, I think there's a couple of advantages for a pharmacy-driven adherence program, really. So the first is related to accessibility. For most people, the pharmacist at the retail pharmacy is definitely the most accessible healthcare professional that they come in contact with, and they're interacting on a regular basis, right? Kevin touched on this earlier when he mentioned how many times somebody sees their pharmacist versus how many times they are interacting with their provider. So that's really important. Patients are filling their prescriptions every month. And this is important, really, particularly for medication adherence, right? Because this is an area that requires constant attention. There's many variables that are going to impact members' ability to stay on track with their medication, right? And those can change over time. So regular, accessible interaction with a pharmacist is just super important. The other key advantage, I think, to the retail setting is that pharmacists build very strong relationships with their patients, right? And patients put great faith in the advice that they receive from their pharmacist. We've seen in our data over the years that strong patterns of engagement typically lead to better performance. So leveraging that retail setting to support adherence programs is really a key to success.
Yeah, I couldn't agree more with the accessibility and relationship aspects with your local pharmacist. I know I personally have many pharmacist friends on my speed dial, but also the personable interactions I receive just come through the drive-through, having the pharmacist ask how my son's doing and so on. But yeah, the personal engagement just really makes a huge difference when it comes to trust, and especially in healthcare, it's super important. With that, how have you integrated the several adherence and member engagement strategies effectively? It's a loaded question, huh?
Yeah, right. This is a big one. So, but it's important. We really have embraced the multi-channel approach. And the idea really that to ensure patients are engaged, that we meet them where they're already receiving care. So we've already talked a little bit about the engagement in the retail setting. The other key area that we've integrated our program is through ambulatory care pharmacists who are working right at the provider office. Again, Kevin mentioned this earlier too. This is one setting that we really have embraced. And it gives us the ability to leverage, I'm going to say, two critical things. One is the relationship that the patient has with their provider. So similar to the retail setting, we know that patients are highly likely to engage with pharmacists that are working directly with their provider. There's a trust there and a relationship. The other key factor is how we've structured, from a health plan perspective, how we've structured our value-based incentive arrangements with our larger provider partners, right? The medication adherence measures are so important to our star ratings, are so impactful, right? We emphasize and make them highly visible in our BBR arrangements with our providers. And this gives us, frankly, the ability to leverage the financial incentives that help drive performance. The other thing I want to emphasize about the ambulatory care setting, and what I think is really important here is how closely from a health plan, from the health plan side, how closely we work with our providers, how we support our providers. This is really important. We have a team of provider-facing pharmacists and quality consultants. They meet regularly with providers just to make sure that they understand, our providers understand how to use the tools and the resources that are available for medication adherence, right? So things like prioritize member outreach reports that, we provide frequently, performance reporting, things like that. We make sure we're supporting them from that end. And also that our team is available to help with any questions or issues or barriers that the provider is experiencing. So I feel like that's a real key piece here. The final piece to our engagement strategy is our internal team. And we have, a team of non-clinical customer service advocates that provide telephonic support and outreach for medication adherence. I think it's, again, really important to understand the value of leveraging an internal support team. Having this team gives us control over which members are prioritized for outreach and the ability to pivot if necessary. So a couple of examples here for performance reasons, right? So if a measure is underperforming, or maybe one of our contracts is underperforming, we can direct our internal team to help focus in those areas very easily. And also our internal team is very good at helping our members with their plan or benefit questions. These things come up quite often during the medication adherence calls. They can help identify opportunities for extended day supply medications. What does their 90 or 100-day benefit look like? Mail order, home delivery options. And members frequently have just general questions about their plan and coverage for a variety of things. So this team is really great at assisting members and either assisting them directly or finding the right resource to help. And then the other thing that our internal team is so important for is that we can prioritize members that have other gaps in care, right, that are important to the health plan. Our internal team, they have visibility into open gaps outside of med adherence, maybe even just outside of the pharmacy measures in general. So when members need other types of care, like mammograms, colonoscopies, or eye exams, our internal team has visibility into those things, and they can really help direct the member or help them understand what resources are available to help them close those gaps as well. So it just gives a nice, rounds out the service in terms of how the health plan is supporting our members more holistically.
Yeah, that really embodies the importance of that multi-channel approach. It just really shows the importance of each channel and how they can really contribute to reaching out to your members and closing those gaps in care. It's definitely not one size fits all, and you can have and find what channel works best for each member, I think, just based on how they interact with each channel. And maybe kind of extending out that a little bit more, what's driven the success for Highmark Stars program?
Yeah. I think, again, going back to that multi-channel approach, I think that is really key for our member engagement, really. I don't think any of the strategies that we deploy by themselves individually is really enough on its own. It's really the combination of efforts from across the network of retail pharmacies, providers, internal teams, and of course, the vendor support that really makes a difference. So I'm going to just take a second here to emphasize the concept of the vendor support. I really believe that the relationship between the health plan and the vendor is so important. As you know, we work really closely with the outcomes team to make sure that our voice is heard, that our needs are being met by your program, really. And Julia, I know you can attest to the fact that the Highmark team gives lots of feedback and has for quite a number of years to your team. But I really think that it helps you build a better program, a better product, honestly. The program has definitely grown in the last 5 years that we've been working together. And I think a lot of that growth is the result of the collaboration that we have. So I don't want to, I just want to emphasize that the vendor as a partner in all of what we're doing. The other piece that has really helped support our success is really a deep understanding and how we respond to the data. So we have a strong actuarial and analytic team supporting our program at the plan here. They're really key in helping us understand where there's risk as well as opportunity to improve and change course if necessary. And so I think adherence, really medication adherence, is one of the most challenging and dynamic measures within the STAR program. You really need a layered, like multi-dimensional, you need a team approach really to be successful. I think that's why I enjoy working on it so much.
You mentioned that vendor support as a piece that makes a difference. I know we as your vendor, we definitely feel that collaborative spirit with Highmark and a lot of other our clients as well, but it's really evolved in more of a partnership with Highmark, and it's turned in less of a client, vendor relationship, and that partnership kind of that you described, and where we're able to take that feedback that you openly give us, and to your point, just really ultimately improve the product that we're providing to you guys as well to meet your needs. We definitely appreciate all of that. All right, let's round this out here. What excites you the most about the impact of quality pharmacy programs on the future of the profession and the communities that they serve?
Yeah, good question. So really what I find most exciting is the positive impact that these quality programs are having on pharmacy practice, and ultimately on patients, right? So these programs, while they're focused on STAR measure performance, they're not just about meeting performance goals. They're really a gateway, I think, to improved patient care. So pharmacists are using these opportunities to identify patients who could really benefit from a medication consultation. And that's having a much broader impact than just the STAR performance itself. It's leading to better overall medication management for a wide range of patients. It's not just about adherence or statins or safety measures. It's about pharmacists taking a more proactive role in identifying the needs and improving medication management across the board. So in the ambulatory care setting, providers are leveraging pharmacists in the office to improve overall patient care by addressing a broad range of medication-related issues. And for the retail pharmacies, getting financial support for clinical consultation improves patient care and frankly makes their work more rewarding. I've seen quite a shift in the last 20 years of my profession, really. It's exciting to see the profession of pharmacy grow and to see the expertise of pharmacists being utilized in such an important way.
Yeah, I couldn't agree more. Here at Outcomes, we're definitely excited to be involved in the evolution of the profession of pharmacy and definitely work with those partners such as Highmark to do so. That kind of rounds out our Q&A, Lisanne, but Kevin, did we have any Q&A from the audience? I know, let's use this time that we have. We're super appreciative of you joining us, Lisanne.
Yeah, absolutely. This is the audience participation time. I appreciate all of your comments. So I have a couple questions that have come in already. So one of them is, given the changes to medication adherence and STAR ratings in the future, what are you thinking about in terms of 2026 and beyond for program changes, if any?
Yeah, that's a good question. I mean, I don't think that we can ever really take our foot off the gas here, if you will, even as the measure STAR weights might be temporarily reduced due to some technical changes. I feel like we really have to keep our foot on the gas, because as we have seen over the years, performance just keeps getting better across the nation, right? I mean, 4 or 5 years ago, I'm not sure I anticipated seeing some of the performance scores that we're seeing today. And and the margins are just getting tighter and tighter in terms of high performing plans, high performing pharmacies. So I really think that we're going to have to continue to come up with, I think we're going to have to do two things. We're going to have to keep our foot on the gas. We're going to have to continue looking for new ways to support members, but we'll also have to make sure that what we're already doing is being executed appropriately, right? So like, it's about coming up with new ideas, but it's also about making sure that what you're doing in an effective way. Sometimes it's challenging to differentiate, but I feel like we have to look at our current processes and say, okay, are we really capitalizing here where as much as we think we are? So.
Great. We have a question more probably for me and the outcomes team related to how are we leveraging AI, artificial intelligence, in the medication adherence space. So with that, I'll take a step back. So we work with payers collaboratively. We really want to listen to them. We want payers to challenge us. So in a lot of cases, we're working with payers on their raw data and trying to identify where the risk lies. And so identifying either who your high-risk population is, who's most at risk for future non-adherence, based on patterns that you may see in the data, other demographic, regional related information. And then we have a number of different channels that we can provide those solutions to. Our primary channel is the community pharmacy, but even saying community pharmacy is a number of different ways. Within the community pharmacies, we have a number of embedded solutions to engage patients. So we can help the pharmacy do automated outreach to some of their patients, either through phone or text. We can help the pharmacies schedule appointments with patients, and we can help the pharmacies have proactive and impactful dialogue with the patients. But we also have other solutions where there may be gap or something supplemental from a channel standpoint. We can reach out to patients through phone or text directly. We have a clinical call center with national reach that, much like an ambulatory clinic pharmacy would do, our telephonic based pharmacists would provide support for patients where they might need it, meet them where they are. And so through all of those interventions, we're able to sort of look at the likelihood of impact. And so we're taking all the interventions that we're making, all the different channels that those are done, we're looking at the impact and then assessing really a likelihood score for a patient to respond to an adherence intervention or any other intervention like a comprehensive medication review or a biometric or a lab screening. So there's a number of different areas where we're using AI to mine data, evaluate data, do some strong analytics, but then also from an intervention standpoint, determining where those interests are or where those interventions will be most impactful. All right, I have another question for you, Lisanne. Beyond adherence, how are you approaching other value-based arrangements around pharmacy?
Let's see. So it depends on the resources that are available, I would say, with our partners, right? So I think the most important thing to understand is we want to capitalize on that pharmacist in an ambulatory care setting where possible. And we have mainly been targeting the adherence measures as a way to sort of, again, like open up that door for that pharmacist in the ambulatory care setting to set them up to be successful, if you will. But I think what has grown out of that has been this practice for the pharmacist within the provider's office that goes beyond just the value-based reimbursement arrangements that we have. So as soon as these pharmacists are able to sort of capitalize on the incentives that are available for health plan, maybe related STAR programs like adherence, or we do work in the statin measures as well. And just starting to get into the safety measures this year as they're now scored. So we're leaning on our pharmacists in those ways as well. But it's really the ability of the pharmacists to work in that environment that go beyond the value-based reimbursement areas that we have set up. It creates a situation where the provider becomes reliant on the pharmacist to help them with general chronic care management right there at the practice. So those things go beyond the VBR programs that we have. We are mainly focused on star-based types of programs for those incentive programs.
Great. I'll probably close out then with one more question for you. So I mentioned I've had the opportunity to practice in a number of different pharmacy spaces, including academia. So I spend a lot of time talking to students and getting them excited about the profession. Obviously, I'm passionate about it. And I spend a lot of time with patients. And so I tell pharmacy students, hey, community pharmacy is a great opportunity to have access to people. And one of the things that we've seen in the MTM space over the years is that not only are patients taking more and more medications, they're seeing more and more physicians. So the prescription piece of it is completely disaggregated. So physicians don't necessarily know what's being prescribed by other physicians. And then we're also seeing as patients sort of struggle with, like, how do I get my prescriptions, the cost of those, we're seeing more and more patients use multiple pharmacies. And so that creates even further fragmentation in the system, more risk, more adverse drug events. And we know how challenging that is. So I always tell pharmacy students, like, if you could tell a patient one thing, have them use one pharmacy and have them keep their medication list with them. So it's super important. We've talked about the importance of the pharmacy developing a relationship with it. So I always say, hey, like, if you're going to do something simple, try to keep your med list with you and just use one pharmacy. That way, even if you can't keep your med list with you, you have that available. So Lisanne, if you were going to give advice to pharmacy students or pharmacists or even patients out there, like, what are one or two things that you like to tell people?
Yeah, I mean, I've worked with students in my career as well. I feel like the most important thing for pharmacy students kind of coming into this changing world of pharmacy practice is to keep an open mind about what the opportunities are in terms of their career paths potentially. But from the standpoint of just because a certain practice hasn't fully developed yet, they should really keep an open mind about how to bring the profession forward. What's going to help. Get creative about what's going to help pharmacists be more impactful within the healthcare system, right? So I feel like as a profession, we might still be on the cusp of being a tad bit underutilized in terms of our skill sets. I think we're sort of starting to come into our own with some of the opportunities that we have today. But I would encourage students to work with their patients in such a way that brings out that really takes advantage of their skill sets that they have, because from what I can see coming out of the schools, these kids are very bright. There's a lot of bright pharmacists within the profession. I think that it's going to be important to make sure that we continue pushing the envelope in terms of the capabilities and the accessibility that the pharmacist has to really change the way that we interact with patients within the healthcare system. I think there's room for some growth there.
Well, great. Thanks so much. I really appreciate your time today, and I appreciate everyone's time today for attending this workshop. It's been super valuable. Julie and I will be at the PQA annual meeting in Tampa, Florida, coming up. Hopefully, many of you will be there. We'll also have a number of different folks from the Outcomes team in attendance. We would love to spend time with you. So again, thank you for your time today. And we hope we'll have an opportunity to see you face-to-face in Tampa in May. With that, Richard, I'm turning it back over to you.
All right. Thank you, Kevin. And thank you also to Julia and Lisanne. It's been a very informative conversation. Appreciate leading the discussion today. Just a couple of quick announcements in closing. First, want to again thank Outcomes for sponsoring today's webinar. And as Kevin mentioned, we hope that you will join us in Tampa, Florida, May 19th through the 21st for the PQA annual meeting. Early bird registration is open until April 21st. And if you were able, on day one of the annual meeting in the morning, we have a special live continuing education event that's focused on the fundamentals of quality measurement and quality programs. You can learn about both of those, both the annual meeting and this event, on the annual meeting website. Thanks again for joining us for today's webinar, and please take a minute to complete the survey that will pop up at the webinar's close. Have a great day.